morning and welcome back. Are we buckled up? Because we are going for an intercontinental travel now from Africa to India. That depends. If you can speak Sanskrit, you will be granted a free business class. So India has 26 official languages, and initially we thought that we would present it in Sanskrit, but then one of the speakers objected because his mother language is Kannada from South India. So after a lot of debate, we finally decided to present it in English only. So there was a time, and not long ago, just a decade back, when many vaccine stores, even at district level in India, didn't have stable electric supply, let alone any mobile connectivity or anything. And during the polio campaign days, public health foot soldiers like me, or some of you in this room, we used to visit not the grocery stores, which Deborah showed, but the ice cream factories at the dead of the night, because that was the only source of ice packs to keep the vaccine cold. And we used to carry a tube thermometer to dip into the brine solution of those ice cream factory chambers to see whether the ice packs will be frozen in the morning or not. So from that point, now India has gone through a transition where in those same states, in those same provinces, the state program manager sitting at the state headquarters can see the movement of the vaccine and logistics stock and the temperature excursions in real time. And this magical transformation has been made possible by EVIN, Electronic Vaccine Intelligence Network, which is the Indian version of VAN. So ladies and gentlemen, today we have 3 speakers from India who will elaborate this exciting story. While introducing them, let me have the opportunity to take you through a very brief journey of that evolution of EVIN. It all started with development of a smart technology by a kind of startup technology company in South India in the city of Bangalore, which is also a kind of cyber capital for India, Logistimo. And Logistimo piloted that software with the help of an NGO, Corona Trust, just within that city limits in the year 2012. And after that successful software pilot was conducted, it was handed over to the Immunization Technical Support Unit, nested within an organization called Public Health Foundation of India, which acts as the techno-managerial secretariat for the immunization program for Government of India. So the Logistimo team who developed the software, one of the brilliant brains behind that software development is our first speaker, Arun Ramanajapuram. Let me invite him on the dais first. Arun has a master's in computer science. He has served as senior director in Yahoo and Xerox. And he then co-founded this Logistimo as the innovation company which has developed this brilliant software. So my first, second, third speaker is in the chronology of EVIN evolution, not in the order of how the speakers will present. So please have a seat. So once the software is developed, now Arun is here, as I was mentioning that it was handed over to ITSU, the Immunization Technical Support Unit at PHFI, and PHFI has a immunization supply chain pillar. So they decided to bring in the other important components. Throughout this VAN workshop, what we are listening here, that technology is just an enabler. It supports your innovations, but the main components of the entire system are the peoples and processes. So this technology was packaged with all the relevant interventions about streamlining the processes, about building the capacity of the people, and ITSU did that. And the person who was the architect and actually who named this intervention as EVIN, he is our second speaker, actually the first who will introduce the topic to you, is Dr. Bhrigu Kapuria. Please welcome Dr. Bhrigu Kapuria. He is a public health specialist, having a master's in his public health. Started his career as a primary healthcare physician in one of the western states in India, and then had a long journey in public health through HIV/AIDS program, then in the immunization program in PHFI. Then he actually played a pivotal role in introducing Rota vaccine when he was in JSI, and now he is the senior immunization specialist in UNICEF India. So technology was developed, and technology was packaged with the people and process intervention, and thus was born EVIN. It was piloted not in a cyber-savvy city. It was piloted first in two, I would say, most difficult rural districts in western UP. Whoever is familiar with Indian topography and states, Bareilly and Shahjahanpur, and those were evaluated, the field results, the pilot field results. And those results, as a proof of concept, that it works not just in Bangalore, but it works in UP, Uttar Pradesh, which is the highest burden, in all terms, in disease terms, in vaccination challenges, in RMNCHA program, that convinced the government of India to take the solution for scaling up. And Alan is here, so Gavi came forward with their HSS support, through which Government of India took probably one of the most ambitious decisions since the inception of the immunization program to scale this EVIN solution across 36 states of the country. That means 665 districts, 1.2 billion population. And already 12 states are having that solution. And in the next phases, it will be scaled up across the country. And that scale-up responsibility goes to UNDP. And the man in charge, who has already become a celebrity among you since his panel discussion and poster presentation yesterday, Dr. Manish Pant. So please welcome Dr. Manish Pant, who is, again, basically a physician and then trained as a community medicine specialist, has spent quite a lot of time in South Africa itself when he was in Red Cross. He was also one of the persons who actually did help building the Immunization Technical Support Unit in PHFI, and now he is the Senior National Program Manager for UNDP in charge. With that short introduction, let me hand over to Dr. Bhrigu for taking it forward. Bhrigu, please.
So, thank you, Dr. Arindam. You brought the entire journey of 3 years or 4 years into a package of 5 minutes. I am here to just set the stage right, bring in what is the scale. Okay, many of you who are familiar with India understand that. And the effort here is not to boast on something. The effort here is to tell the size and magnitude that it requires. Any million that I say comprises of children. And we have to reach every children. So, and the complexities that exist across the world exist in India. All varieties of that. So when you talk about scale, India conducts the largest immunization program in the world. We target around 27 million newborns. So it's 27 million newborns are born each year. We target 30 million pregnant mothers. If you bring in only the under 5 age group children, that is 100 million children to be reached every year. I was just looking at the population of countries, and if you synchronize all the countries in that sequence, and if you remove the first 13, the remaining countries don't even have the population of 100 million. The target of immunization program is to reach 100 million children every year. So that's the scale. The other important point is that to reach these points, this is all divided into 27,000 cold chain points spread across the country with all kinds of geographical, political, language, all challenges across. 95% of these 27,000 cold chain points are sub-district facilities. That is, you go down deep into the rural areas. The program also caters to 650 million doses every year, and there are 9 million sessions that are conducted in India, 80% of which is outreach happening in a village. Just to also give you the magnitude, that this entire population of 100 million children, the 27,000 population is spread across a geographical area of around 3.2 million square kilometers. So it is not concentrated, it is all dispersed. And to give that an idea, if you look into the population densities, there are areas with the capital of Delhi, which has a population density of around 12,000 persons per square kilometers, to areas of Arunachal Pradesh that have 17 people per square kilometers. So the magnitude of things reaching into an urbanized area to remotely sparse population across the geographies. If you look into the financial part of it, India spends around $1,200 million a year on immunization, bringing around all the services, of which $500 million are just for vaccine procurement. The good and appreciable part is 93% of this $1,200 million is by Government of India through their own procurement. So the external support or all other things only fall under that 7% category. So that's the ownership part of that and the entire program. When I talked about the 27,000 cold chain points, we have a 5-tier supply chain system, starting at the national level, then to the state, district, division, PHCs. This appears to be very simple, but when you spread it across entire country, it goes humongous. There are around 70,000 equipments through which these vaccines pass across the country in the 3.2 million square kilometers of area. And there are different challenges that come inside it, whether it's low human resource environment, whether it's low resource capacity, whether it's limited infrastructure. Just to give you the challenges that were there before we started even, and which still exist, is non-reliability of real-time stock. When we started designing even, we started designing the entire process into a bigger scale, and I coined a term called a coal mine effect. A coal mine effect is an effect where you're just able to plan to the next visible light, and then you are not able to plan. So you have to move to that light, and then you again plan whether you will go right or left. That was the situation in the country. You can only see a level below, and that too only once in a month. What happens below that, you don't know. How it happens, what are the vaccines being there, what are the vaccines management, that all gets out of it. So visibility was one biggest challenge. The second challenge was on temperature. How are these vaccines being stored? The only temperature records that we have was the thermometers that were inside it. And the thermometers, the person who's handling it knows whether the temperature is right or wrong. So she can shut down the fridge and say everything is okay, and you can't trace back. So temperature monitoring was, again, a bigger challenge. Geographical terrains, if somebody of you might have seen the videos that we played last night, we have places, you name a terrain that exists in India, whether it's desert, hills, mountains, rivers, floods, anything. There are areas in India where Assam, where the Brahmaputra river, when it floods, it cuts big lands. So a land situated today here becomes part of this because the Brahmaputra has flown and added it. So you are planning, every infrastructure goes into that part. The fourth challenge that came forward was irrational, I won't say irrational, but it was stock management, the records based on my understanding, because there was no systematic and streamlined understanding. Every cold chain point devised a strategy and a mechanism to record. And so you have 27,000 kinds of records available. Now, how to track them back, how to link them back. And this led to a mismatch, because the supplies that are happening is ad hoc. I come forward and I come early, I take the stock, even if I require just a month's stock and the stock has just arrived, I take 3 months of stock with me. And somebody who's sleeping comes down and says, I need a month's stock, and the stock said only 5 days left, you take 5 days. So that differential existed. When we talk about digitalization, India is big in IT. We say, why is digitalization, why don't you digitalize when you invest $500 million in? The challenge is, as I said, 95% is sub-district. At sub-district level, the first problem is electricity, reliable electricity. So I don't have reliable electricity, okay? So if I have an office working in the day hours, there is a 12 hours of electricity cut going on, and so the electricity will only come at night. Or the electricity will come at 3 days after. So you have unreliability. Even if you have a better reliable electrical systems, you do not have functional computers available. So functionality of computer is a level 2 challenge. When it comes to a functionality of computers, the third is, even if I have electricity, I have arranged for UPS to have a power backup, I have arranged for a computer, I don't have data entry operators to do data entry mechanisms. So that was the third biggest challenge. Now with such a vast scale, you cannot just hire human resources to do a data entry. With all of this done, I don't have a reliable internet connection available. So these are all challenges that brings you towards digitalization. Just giving you the magnitude and size and putting these things into context when you talk about scale up. So for the next part on technology, I would like now to introduce and ask Arun to take over. Thank you so much.
Thank you. So thank you. So I'd like to talk a little about technology and data, and I think we have heard many success stories, and we can all agree that high quality data from the last mile is very critical in the process of transforming supply chains. And in fact, we believe that's the real first step. Getting the last mile data is almost the first step in, and that's kind of the philosophy that we started with. And that's also the most challenging, because it's easier to start off with the top level where there's internet and infrastructure, but whereas from the last mile it's very difficult. And you kind of see that the human resource capacity is limited, infrastructure availability is limited. So as a result, we chose the mobile phone and the mobile app as the primary data collection and decision support, not just data collection, and decision support tool, which is the only computing device that they have. It could be a feature phone or it could be a smartphone. Have a very robust multi-channel communication mechanism that leverages GPRS, voice, offline store and forward kind of facilities, so that we kind of address the infrastructure limitations. So
you need to use the...
Sorry?
Yeah.
Yeah. So, and before I come to this, actually, I just wanted to just talk about like certain principles on which we kind of went about the design. One was really that it has to be simple and very user-centric, where a user at every level in the supply chain is able to easily use it and provide the information that they need to provide, as well as use the analytics for decision-making. And the second one was we would be bottom up, in the sense there was a principle of empowerment, where everybody is empowered to be able to make those decisions. And I think the other one was to be impact oriented, where data becomes very important, data quality becomes very important. So now going forward, the actual solution was to connect the first mile through the last mile. It's a cloud-based solution, has to be very scalable, and you can see that there are all the levels of stores are connected to a central system. And everybody is connected through the web application as well as a mobile application. It could be the person at the PHC. Typically, below district, they only are comfortable with mobile, including in the warehouse. And then there's a national MOH personnel that are connected to this, the support personnel who are supporting the users. And then there are also devices, temperature sensors that are monitoring all the fridges. So these sensors are provided by Nextleaf, who are also in this room. So essentially, the mobile cloud technology gives visibility into stock consumption. It enables optimal decision making to ensure stock distribution and availability. So the first part, when the pilot started in Uttar Pradesh, in the 2 districts in Uttar Pradesh, it was important to kind of do a system design, or perhaps a redesign, by carefully studying this problem along all these dimensions. And it was not done in isolation as a digital system design, but basically the physical register and the digital data elements. Data design was done in conjunction in a way that they are complementary with each other. And I'd like to, since Dr. Brigu was instrumental in this, I'd like him to talk about this for a couple of minutes.
So in the register design, as I said earlier, we had different components. We had different varieties of registers being documenting these stocks. And so we looked across what are the key parameters that are required. We brought all the parameters together, got in consensus with the state government, discussions with the ministry, that what is it that is bare essential and what is the mechanism. That all mechanism was brought together and a final lay product was created, which helps the system. So one important product and one important point in even that we need to is the registers and the mobiles do not duplicate. It is not that somebody has to enter in the register and then enter in the mobile and doing a duplication. These are cumulative process. A register leads you to what goes inside the mobile. So once you have a physical stock inventory, which brings in the authenticity at the state level, at the point level, and also leads you to what goes inside. So you have a relevant chain that has been brought in. And these relevant chains, these registers were then authenticated by the government and now are available across every point in the country, which was one big transformation, removing everything, bringing in standardization so that even if even comes 3 years later, you have a system ready which feeds in directly to the system. Back to you, Arun.
So in very simple terms, the registers helps in the tallying process and reduces errors in that process. And then the data entry then sends that data over, gives visibility and also analytics back. So how did we empower the cold chain handlers, who are the people at the village health centers? So basically they enter issues. The standard operating procedure is to enter it within 24 hours of a session. And receipts as and when they receive, stock counts either on a periodic basis or whenever there are data entry errors and it needs corrections, they enter discards and then they can place orders. And this happens on both the closed and the open vials. And routine immunization, the routine vaccines are treated differently from campaign. And what does that person get back in return? Real-time stock views, alerts on low stock and expiry, optimal recommendations on what to order based on consumption patterns, and then a delivery status that something has left the warehouse and is arriving at your place, and then temperature alarms if there are problems in the fridges. Then potentially operating procedure reminders to enter data and so on. General announcements that can be done, happy festival or whatever it is. So in the beginning, you might have to find various ways to motivate them, mandate, incentives, whatever. But then in the end, they see value and then adoption happens. And clearly, over time, the system can deliver more value. So visibility and analytics at the last mile for the last mile on a phone, okay? And the other thing is about the temperature data, and that's the cold trace device that you see. And temperature sensors are sending temperature and device health over GPRS or SMS. And then with our multiple monitoring points, 3 points in the fridge are being monitored, the top, middle, and the bottom, because there are temperature variations there and temperature mapping is being done. Hot or cold alarms, analytics on vaccine exposure and asset functioning. There are more than 8, I think there are 8 or 9 key indicators that you're monitoring on that, and many sub-indicators. And then the remote logger device management to change the configurations of the device to understand if a sensor is disconnected or whatever, whether the battery is there and the device signal is there and the device, all of that can be done through a web dashboard. So the other aspect is to empower managers, because you need a feedback loop at every echelon in the supply chain. And so they need the tools to be able to monitor and see where problems are, where capacity is needed. And this monitoring happens on both the commodities as well as on the human performance, because all response times are being measured. The response time to replenish, the response time to repair of a fridge, all of those are measured, and those scorecards, performance indicators are available to the supervisors. And this is available at every level, at the district level, at the state level, at the national level. And actually, the nice thing about it is it's the same set of dashboards. So any kind of a new feature we build into the dashboard, it's available to every person all the way down to the medical officer in the cold chain and to the national person, the same indicators. But they might choose to use subset of those indicators. So in some sense, you need a very robust technology, especially to scale and with huge data volumes, and which deals with device heterogeneity, because the data can come from paper-based systems that can be put into spreadsheets and uploaded, or from mobile phones, feature phones, smartphones, web browsers and computers, and works across network channels of GPRS, SMS, and voice. And then there's a strong service management middleware to ensure a robust collection of data, even in spite of in the absence of network, and with IoT, Internet of Things, like kind of a middleware. And then there's data on logistics and human resources, delivering both analytics in real time as well as the the analytics that comes through analysis of the historical data. So it's a very easy to use system on web and mobile. It has capabilities for doing inventory management, order management, batch and expiry management, demand forecasting, optimization of replenishment quantities, workforce monitoring, geo-tracking, transport routing and scheduling, integrated temperature monitoring, and big data analytics and dashboards. We are also getting into more capabilities to socialize the supply chain better so that we can have ground-up community empowerment using mobile phones, kind of exploring some concepts there as well. So the other important aspect is not just technology. The technology can scale and deliver, make it easy and provide the analytics at fingertips. But it's a very strong human resource network that has been put up by UNDP along with the ministry, working very closely with the government officials at every level. So there's a logistics manager in every district whose responsibility is to ensure availability and potency in that district. And he's also responsible for capacity improvement. So continuous feedback for health workers and officials in the network. And actually this now triggers a kind of a movement where more data is coming, more people within the administration are exposed to this data. And there's a combination of a push and pull for analytics that's actually going on, which Dr. Manish will talk about, which kind of what we're seeing is leading to a virtuous cycle of data use culture. So one of the things is the data volumes are very huge. We have at this time 10,000 stores, 9,500 of them are in villages. We're getting more than 2 million inventory update transactions per month, about 80 million temperature samples every month. And there's also qualitative feedback. The app lets people write back, and so they kind of constantly give feedback, almost like a WhatsApp-like stream. And then there are 15 major indicators and probably 40 minor sub-indicators on the analytics part. And then the footprint of the data, we have more than 500 gigabytes of raw data and greater than 2 terabytes of analytical data across the system. So when Dr. Manish yesterday mentioned about my hairs becoming gray, it's in trying to protect this data from hackers. So, and the other thing we are looking forward to is, there are many things, but I'll talk about predictive analytics and particularly flowcasting. So the whole thrust right from the ministry is to move the supply chain to an informed push model. So a pilot on order management and forecasting is already begun in Uttar Pradesh. And we kind of look at it as flowcasting because in the vaccine scenario, the demand is somewhat predictable, but still forecasting is important. Consumption-based forecasting. But at the same time, there are severe constraints around logistics, availability of transportation. If the driver is available, the vehicle may not be. If the vehicle and driver are there, the fuel may not be, and so on and so forth. So basically, continuously assessing how the demand is changing and modulating the flows, because now you have the view of the entire network. So it's almost like a river that you can modulate the flows. So with objective functions where we ensure no stock out at any point, with some constraints on transportation costs. So that's the big model we are going to try with all of this data next. Thank you.
Thank you, Arun. So moving on, what has been the impact of scaling it up in a country like India? And I can assure you, he's not the only one with white hair. I'm graying too for the last 1 year as we started to scale up across India. We have now covered 10,500 cold chain points. So what are some of the transformations and early impacts we are seeing in India? One is, we see this as a big health system strengthening improvement piece and promoting e-governance across. As we said, we have standardized stock keeping methods. We are strengthening the cold chain human resource. They're empowering them, training them, reorienting them on effective vaccine management overall. Using simple technologies, we have had over 4 or 5 software upgrades from the time we started, and new features keep getting added. So they get trained, they get retrained. The temperature monitoring technology is now spread across. and the real-time availability of dashboards to the district, state, and national level managers. So that is kind of getting to be a game changer slowly and slowly. I think this is the big game changer that we are now seeing. Real-time analytics, as I demonstrated it last evening, but this is available, tailored for every level of the cold chain hierarchy. So at a district level, a district manager can see only his district picture, and the state manager can see his or her state picture. And a national manager can see the whole country and drill down the analytics and picture to literally each and every cold chain point and cold chain equipment across the country. Real-time visibility of temperature monitoring with alarms is ensuring more and more safe storage of the vaccines. This is a very important step. The big human network that we had to set up looks big, but actually in the context of India, not so big, is supporting the government system. Ultimately, one of the main features of even rollout was that we used the existing government system to carry out the data entry. We did not establish a parallel network. It was just a system that existed. We reoriented it, and now we have support staff to just provide backup support, and it's the main government officers and workers who do the data entry. Data is key, and data is used both for visibility and analytics. So whether it is visibility around stocks or on demand or on supply, on temperature status, the basic fact which Bhrigu started off by saying that it was a coal mine effect, you could not see level below you. Now you can actually see from national down to the cold chain point, each and everything very clearly. Just the fact that you are able to see the stock of vaccine and its status as understocked, overstocked, normal stock is a big, big game changer in India. And along with that is analytics. That's the big feature of this product, is that the managers get analytical reports, whether it is on stock abnormalities, with alerts going out, how to replenish stocks. You do not, like Bhrigu was talking about, the person coming first getting more stock, person coming last getting less stock. That is gone. We are moving to an informed push model where the higher store now sees the stores below them, and then they optimize the vaccine distribution accordingly. We can see trends of nearly everything: transactions, stockouts, normal stocks, maximum stocks. They have different options available now. We can also track human performance, whether they're entering the data on time, or is the stocks getting replenished on time. So there are indicators, and that feedback keeps going back to the managers. So it is kind of a governance tool as well. So I just want to take you through some very early trends and analytic information. Now, this is very important. This is across 10,500 cold chain points. We are seeing across the 11 states that within 7 days of a session, they are entering data. More than 95% are regularly entering data. So that means the data is very fresh and very new. So if there is a session today, one of the indicators is that the person at the cold chain point level should be entering it within 24 hours. So the data is very recent. As Arun talked about, since last year, August, when we started scaling it up, the number of transactions, whether it is an issue or a receipt or a stock count, these digital transactions are growing and growing. So our data server capacity keeps growing. I think January, we were logging in about 2 million transactions a month. And remember, this is only 1/3 of the country. We have another 2/3 coming up. So I can expect that to treble, if not double, if not quadruple. We are also seeing reduction in stockouts. Now, these are instances, we have already seen a reduction of over 50% in the first 3 states where we started off with, and they are huge states with over 5,000 cold chain points. So that is something very interesting. We are also seeing that not only is the stockout reducing, the duration of the stockout is also reducing, and on average, it has gone down by 50%. Stock availability, the vaccine availability, the number of stores that have vaccine for 27 days in a month, that is 90% of the time, has gone up. And so there is a lot of, while the demand side keeps generating children to come to the centers, at least we are ensuring that the vaccines are now available. We can also do assessments around cold chain space, which is especially useful for new vaccine introduction. And you can do the cold chain space assessment at national, district, state level and see how, say, rotavirus or PCV introduction is going to change that space. Finally, in 2 years' time, this is what even will look like. It would have covered 36 states, 27,000 cold chain points, 56,000 government staff trained, 55,000 to 60,000 loggers installed, 650 million doses tracked from the manufacturer to the last mile. So the impact is that we are moving to an informed push model from the higher store to a lower store, more on consumption-based planning and forecasting. Also, the data and the information is now altering, or not altering, but more kind of affecting policy level decisions for the ministry, whether it is to do with how you stack the vaccines or how you transfer the vaccines, etc. So all of this is now helping redesign or reorient the vaccine supply chain. The pipeline is getting reoriented from the manufacturer to the last point. So in summary, I think human resource is very essential. You may have the good technology, but human resource network around it is critical. Both small data and big data are important. We are moving into a big data architecture, and a lot of predictive analytics can be done by using data. We don't have to go into causal analysis every time. This is the key. You have to empower the last mile person to get ownership into the system. We have created a brand around even now in India. So even states that don't have it now are demanding it. So the worker already knows I'm part of a transformation that is happening. We get good feedback, and it is a cost-effective technology. So the cost is important. We are now in the process of trying to study the detailed cost benefit and cost-effective analysis. So this is what it is overall from even.
Ladies and gentlemen, who has the first question?
We have 2 minutes, so I guess just one question.
I just like to add one thing to the analytics, because in India, 1% improvement in availability means a lot of children. So that's why for us, we have to strive to get data from every nook and corner, and whether it is signal is there, signal is not there, we have to find ways to innovate and do that, and also make sure that availability number goes up all the way up, right? So that's when you reach a particular level of high 90s, subsequently there's a last mile to that analytic itself, which is very hard, but it still means large number of children because of the population size. So that's kind of the challenge. So we cannot rest at 98% ourselves.
Thank you very much. Just one question. I loved the slide about the data that you're asking the healthcare worker to provide, but then also the analytics you're providing back. Could you talk a little bit more about what that analytics has empowered the healthcare worker to do? Have they made changes to their operations as a result? Any other impact there?
The first thing it has done is, and this is from the anecdotal feedback that we get, is that it has taken away the accountability and responsibility for the last mile worker, that you are responsible for stockouts or you are responsible for managing the stocks. No, that accountability has shifted to the next higher store. So if there is a stockout, earlier on they would be challenged by the officers, you are responsible. But now they are seeing that their responsibility has shifted to the higher store. So they are free to do their job. They enter the data, they do their work, they come in the morning, they issue the vaccines, they enter the data, the analytics piece is done, and then it is up to the higher level to ensure. So that is one big thing. The second empowerment is that they are finding it very easy to use the system. They are finding that their previous methods were archaic and not good. They're finding the smartphone as a very user-friendly technology, so they're buying into it. So these are two main things. Yeah.